If we get above 1 million cases, Richard, we're really talking about reversing all the great things that have been happening on the continent for the last 10, 15 years. You know, over 5.5% growth rate even during the period of 2008 to 2013. What we're talking about is a fundamental crisis throughout the continent if we don't get this under control in these three countries within the next weeks to months. We think that we can get services, both prevention of spread and treatment, to every village. And that's what we have to do. This is going to be so difficult. It's the most difficult, the most massive, the most complex thing that I've ever been involved in. And I've been involved in, frankly, some of the most complex things we've ever tried in global health. But we have no choice. If we don't do it, we're really talking about a catastrophe that's both human and in many other ways as well, especially economic.
Obviously, the economic effect on these three countries involved is devastating, 10, 15, 20% of GDP. But they are relatively small countries in the sense of as that economic effect ripples out through the continent. How concerned are you?
I'm extremely concerned. We hope that people respond because of the humanitarian needs, but there is self-interest here. Look, if this goes to the point of affecting the entire African continent, nobody will be unaffected. And cases will start exiting the continent and going elsewhere, because right now, if you're a febrile person, if you have a fever and you have diarrhea and you suspect you might have Ebola in one of these countries, the most rational thing for you to do is try to get out of there and get to a place where you can be treated. It's simply the most rational thing to do. We have to now turn it around, so the most rational thing to do is to stay in your country and get treated right where you live. If we can do that, we can get it under control, and that's doable. So if we fail, it's not because this requires some new technology or new drug. If this fails, it will simply be because we didn't have the will to do it.